Is your body trying to tell you something? Today, let's explore a topic that affects many men: how daily masturbation impacts your prostate health. You've probably heard conflicting information about whether regular self-pleasure helps or harms this important gland. Some say it keeps everything flowing smoothly, while others warn it might cause problems. The truth is, what happens to your prostate when you masturbate daily isn't just a matter of frequency. It's about understanding how your body responds. That small gland plays an important role in your sexual function and urinary health, and the way you treat it matters. So let's see what research shows about regular ejaculation and prostate health, particularly whether daily masturbation can reduce inflammation, lower cancer risk, or potentially cause discomfort for men with existing conditions. When you masturbate, several important changes happen in your body, especially to your prostate. This small gland, about the size of a walnut, sits just below your bladder and wraps around the tube that carries urine out of your body. It makes some of the fluid that helps sperm move during ejaculation. As you get older, this gland often grows larger, which can cause problems with urination and sexual function. What happens when you masturbate daily? Each time you ejaculate, your prostate releases fluid that helps carry sperm. This release may help flush out any old fluid that's been sitting in the prostate. Think of it like keeping water flowing through pipes. Moving water stays cleaner than standing water. This flushing action might help clear out harmful substances that could build up over time. Your body responds to regular ejaculation in other ways too. Blood flow to the pelvic area increases during sexual excitement. This improved blood flow brings oxygen and nutrients to the prostate and surrounding tissues, which might help keep these areas healthy. Just like exercise improves blood flow throughout your body, sexual activity increases blood flow to your genital area. The prostate is also linked to your hormones. When you become sexually excited, your body releases different chemicals and hormones. These natural substances can affect how your prostate works and feels. Regular ejaculation helps maintain a healthy balance of these hormones, which may improve how your prostate functions. Many men notice changes in how they feel after ejaculation. You might experience a sense of relaxation or relief from tension. This feeling comes from the release of brain chemicals called endorphins, your body's natural feel-good substances. These positive feelings can lower stress levels, which is good for your overall health, including your prostate. Have you noticed how your need to urinate changes after sexual activity? This happens because the prostate and bladder are close together. When you ejaculate, the muscles around these areas contract and then relax. This process can sometimes help improve urine flow temporarily for men who have mild prostate enlargement. For men who don't ejaculate often, the prostate fluid can become thicker and more concentrated. Some health experts believe this thicker fluid might increase the chance of inflammation or infection in the prostate. Daily masturbation keeps this fluid moving and may reduce these risks. It's worth noting that what happens in your body when you masturbate is not just physical. Your mind and emotions play a big part too. Feeling good about your sexuality and having healthy outlets for sexual energy can improve your mood and outlook. This positive mental state might help you make better health choices overall, which indirectly benefits your prostate. The changes that happen with regular masturbation aren't the same for every man. Your age, overall health, and any existing prostate conditions all matter. What feels good and helps one person might cause discomfort for another. That's why paying attention to how your own body responds is so important. Scientific research has shown some interesting findings about masturbation and prostate health. One large study followed thousands of men for many years and found that those who ejaculated more frequently, about 21 times per month, had a lower risk of prostate cancer compared to those who ejaculated only 4 to 7 times per month. This doesn't mean that daily masturbation is a guaranteed way to prevent cancer, but it suggests there might be some protective effect. The reason behind this possible protection makes sense when you think about how the prostate works. The prostate contains tiny ducts that can trap harmful substances. Regular ejaculation helps flush these ducts, removing potential cancer-causing compounds before they can cause damage. It's similar to how running water through pipes helps prevent blockages. Medical experts have also found links between ejaculation and prostate inflammation. Prostatitis, inflammation of the prostate, can cause pain, burning during urination, and discomfort in the lower body. Some early research hints that regular ejaculation might help reduce the symptoms of mild prostatitis by releasing pressure and improving blood flow to the area. Early warning signs of prostate problems include getting up several times at night to urinate, a weak urine stream, trouble starting to urinate, or feeling like you can't empty your bladder completely. If you notice these signs, it doesn't mean you should stop masturbating. In fact, for some men, regular ejaculation helps ease these symptoms by reducing swelling in the prostate temporarily. The relationship between sexual activity and prostate health works in both directions. A healthy prostate supports better sexual function, and regular sexual activity seems to support prostate health. This creates what health experts call a positive feedback loop. Each side helps the other. Beyond the physical effects, there's also growing evidence about the mental and emotional benefits. Sexual release triggers the production of oxytocin and other feel-good chemicals in your brain. These natural substances can lower stress hormones like cortisol. Since long-term stress can harm your immune system and worsen inflammation throughout your body, including in your prostate, this stress-reducing effect of masturbation might offer another way it helps prostate health. What about testosterone? This important male hormone affects everything from muscle mass to sex drive. Some men worry that frequent masturbation might lower testosterone levels, but research doesn't support this concern. Short-term studies show that testosterone levels might actually increase slightly after ejaculation, though they quickly return to normal. Like this video, if you're committed to improving your health, it helps us reach more men with vital information. Regular masturbation doesn't appear to cause any lasting changes in testosterone production. Does age change how masturbation affects your prostate? Research suggests it might. The possible benefits of frequent ejaculation seem strongest for men in midlife. One theory is that this is when early cellular changes might be prevented or reversed by the flushing effect of regular ejaculation. For older men with already enlarged prostates, the effects might be more mixed, with some experiencing relief and others noticing temporary increases in urinary symptoms. Have you ever wondered if the method of ejaculation matters? According to research, your prostate doesn't know the difference between masturbation, sex with a partner, or nighttime emissions. The physical process and potential health effects are similar regardless of how ejaculation happens. What matters most is the frequency and your body's individual response. While the possible benefits of daily masturbation are worth noting, there are also some cautions to keep in mind. For men with certain prostate conditions, the effects can be mixed. If you have an enlarged prostate, also called BPH, benign prostatic hyperplasia, you might notice that your symptoms get temporarily worse after ejaculation. Some men report increased urinary frequency or a slight burning sensation for a few hours afterward. This temporary worsening happens because ejaculation causes some swelling in the prostate tissue. For a healthy prostate, this swelling goes down quickly. But for an already enlarged prostate, this extra swelling might press more on the urethra. The tube urine flows through, making symptoms more noticeable for a short time. Men with prostatitis, inflammation of the prostate, might have very different experiences with daily masturbation. Some find it helps relieve pressure and pain, while others notice it makes their symptoms worse. This difference shows how important it is to pay attention to your own body's signals rather than following general rules. Over time, how your body responds to regular masturbation might change. What feels good in your 50s might feel different in your 60s or 70s. This happens because your prostate continues to change with age, often growing larger. These changes mean you might need to adjust your habits based on how your body responds. A common myth is that frequent ejaculation uses up your sexual energy or makes it harder to maintain erections. Research doesn't support this idea. In fact, regular sexual activity might help maintain erectile function by keeping blood vessels healthy and flexible. However, if you find yourself feeling physically sore or emotionally drained, that's a sign you might be overdoing it. Another misunderstanding is about prostate fluid buildup. Some believe that not ejaculating causes harmful buildup in the prostate. While regular ejaculation does help flush the prostate, your body can handle longer periods without ejaculation without causing harm. The possible health benefits come from long-term patterns, not day-to-day frequency. Finding the right balance matters most. Some men develop an unhealthy relationship with masturbation, using it to avoid stress or emotional issues rather than dealing with them directly. If masturbation becomes a way to escape problems, or if it starts interfering with daily life, relationships, or work, that's a sign to reconsider your habits. What about physical discomfort? If you notice pain during or after masturbation, especially sharp pain in your lower belly, groin, or when urinating, this isn't normal and needs medical attention. These symptoms could point to an infection or other condition that needs treatment. For men taking certain medications for prostate conditions, daily masturbation might affect how well these medications work. Alpha blockers and 5-alpha reductase inhibitors, common treatments for enlarged prostates, work by reducing swelling and improving urine flow. The temporary swelling that happens after ejaculation might counteract these effects for a short time. Do you know what's happening inside your body when ejaculation feels different than it used to? With age, the amount of fluid released during ejaculation often decreases. This change is normal and doesn't mean something is wrong. Daily masturbation doesn't cause this change. It happens naturally over time as the prostate and other glands produce less fluid. Looking at everything we've discussed, what's the takeaway about daily masturbation and prostate health? For most men, regular ejaculation appears to offer more benefits than drawbacks, especially in possibly lowering prostate cancer risk and helping with mild prostate inflammation. The key is paying attention to how your body responds and making adjustments based on what you notice. Your overall lifestyle also plays a big part in prostate health. Staying active with regular exercise helps blood flow throughout your body, including your prostate. Even a daily 30-minute walk can make a difference. Eating foods with less animal fat and more plant-based options might also help keep your prostate healthy. Foods rich in antioxidants like tomatoes, berries, and green tea have shown promise in supporting prostate health. Staying well hydrated matters too. Drinking enough water helps dilute urine and encourages more frequent urination, which helps flush the urinary tract. This can be especially helpful for men who have mild prostate symptoms. When should you talk to a doctor? Any pain during ejaculation, blood in your semen, sudden changes in your ability to urinate, or persistent discomfort in your lower belly area call for medical attention. These symptoms don't necessarily mean something serious is wrong, but they deserve proper checking. Remember that what works for your prostate health might change over time. Being flexible with your habits and paying attention to changes in how your body feels will help you maintain sexual and urinary health as you age. Many men find that with some adjustments, they can continue to enjoy a healthy sex life well into their later years. The mind-body connection shouldn't be overlooked either. Reducing stress through whatever methods work for you, whether that's meditation, time in nature, or pursuing hobbies, supports your physical health, including your prostate. Good sleep habits also help your body repair and maintain itself. By combining healthy lifestyle choices with awareness of your body's signals, you can make informed decisions about masturbation frequency that support your prostate health for years to come. Like and subscribe if you're committed to becoming the healthiest version of yourself. Thanks for watching.